Hey guys, welcome to part 3 of anatomy focused laser. We've looked at the brain anatomy. Now we're going to look at common conditions that impact the brain that could be useful, or laser therapy could be useful for. So we're going to split these into two categories. So we've got neurological and inflammatory/infectious, and these are just a couple of examples. So we have, epilepsy and seizure disorders, canine cognitive dysfunction, hydrocephalus, vestibular disease, and traumatic brain injury. And then those inflammatory conditions, meningitis, meningoencephalitis, granulomatous, meningoencephalitis, infectious encephalitis, so that could be viral, bacterial, protozoal, fungal, FIP, associated neurological disease, which we see in cats, and many others. And the thing that these conditions all have in common is that they affect cognition, behavior, balance, motor control, all through inflammation, degeneration, or structural damage. And what do I always talk about when it comes to laser therapy is that it helps pain, inflammation, tissue repair. So with some of those conditions, what would be the aims for laser then? So let's take canine cognitive dysfunction first. Our laser aims would be to reduce neuroinflammation, support that cerebral circulation and cognitive support. With meningitis and meningoencephalitis, the laser aims would be to modulate that inflammation, reduce pain, and support tissue recovery. Epilepsy and seizure. Now, this is still an area we don't really know much about. Historically, we don't laser when they are in active seizures or having regular bouts of active seizures. But there has been some indication that it could reduce neuroinflammation, support neuronal stability and recovery. I personally have used it in patients that have seizures from a musculoskeletal point of view, because obviously they get really stiff and rigid muscles as a result. So that's a consideration. Vestibular disease, again, our aims here would be to reduce inflammation, support central compensation, and improve comfort. And then traumatic brain injury, our laser aims would be neuroprotection, inflammation control, and tissue healing support. It's important with a lot of these conditions, brain research, human and animal, with laser therapy is still up and coming, and it does seem to be taking a bit of a turn in that it's getting a lot of interest at the moment, as you'll see in a moment. But at the moment, laser therapy is very much used as an adjunct. It's not a replacement for medical or surgical management in a lot of cases. So what about research for treating the brain? Now, I'm going to throw some references over at you guys. I really recommend you check them out. There's some really great studies out there. And I highly recommend as well the new Laser Therapy in Veterinary Medicine Photobiomodulation textbook, because they have a great kind of chapter that looks at neural conditions, and they talk about treating the brain and kind of many references in there. So when we look at human research, there's been papers that have been looking at different areas. So Alzheimer's by, and apologies for my pronunciation here, Losifescu et al. 2023. There's been research on Parkinson's, McGee et al. 2023, traumatic brain injury, Naser et al. 2016, autism, I apologise for my pronunciations here, et al. 2022, and Palanti et al. 2022 as well. So human research particularly, I would say at the moment, is really looking at laser therapy and how it can help so many different forms of conditions of the brain, both behavioural and, disease and injury. Now, how about animals? I would say the two big areas that I've seen being looked into and researched at the moment: canine cognitive dysfunction and traumatic brain injury. So you guys know with Diesel, I've been treating him for his canine cognitive dysfunction, been really impressed with the results that we've seen there. And the reasons why we get vascular compromise, neuronal, mitochondrial dysfunction, inflammation, and oxidative brain damage. And again, when we look at all of those symptoms, what does laser therapy do? It reduces inflammation, reduces neuroinflammation, supports cerebral circulation, cognitive support. Now, in terms of research out there at the moment, again, I took a couple more references up here for you guys, but they're still early stages, you know, looking at kind of human data, looking at kind of case studies, and seeing what kind of, you know, what are we seeing within those reports. I think we will see something more coming in the next couple of years, so I'm very much keeping an eye on that, and it will be great to have maybe something a little bit more concrete. So we'll keep watching out and see if something more solid does come from a research point of view there. And then traumatic brain injury. So our laser aims here are neuroprotection, inflammation control, tissue healing support, and it can be used for early resolution of clinical signs, and neuroprotective for lingering symptoms. And Oren et al. 2012 explored that interestingly as well. And what we're going to do is, in the next video, we're going to explore both canine cognitive dysfunction and traumatic brain injury in a little bit more detail, because like I say, they are the two conditions that I seem to be able to find the most research around, so it'd be interesting to explore how we would go about treating those. So keep an eye out for the next video, and I hope you'll join me then for part 4 of our series. As always, if you have any questions on anything we've covered, please let me know.